Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What's tonight? Tonight is Monday night, and it is time for Couch Conversations with the Doctors. As always, we're going to go around and introduce our esteemed panelists who are here with us on this evening, starting with the urologist of the stars who hates accolades. But is there a doctor in the house? That's our very own Dr. Terry Mason. Dr. Mason?
Good afternoon. Thank you, Congressman and Nikki for putting together this platform. I look forward to a very stimulating conversation based on the questions that have been raised. And I would begin by saying that we need to look at where does health really work? Who is really the steward for your health? And I think that'll be a way for us to look at it better, because if we're looking for something outside, obviously we can get medical care outside, but and that's a hospital or clinic, but your health is not relegated to pills and potions. And we can talk about that later.
Outstanding, outstanding. Well, to the man who has the best art, the art connoisseur of them all, that's our very own Joseph Harrington. Joe? You're muted, Joe. Joe, you're muted.
I know. I'm getting
There
off.
you go.
Yeah. Yeah. Thank you, Nikki. Thank you, Congressman Davis, for providing this platform. We did have a very robust conversation before this public conversation started, and we'll see where that takes us. By way of background, I spent most of my career in public health and healthcare. I did do some work in mental health and education. I retired in 2017 from the Illinois Department of Public Health, where I was the regional health officer for Cook County, and I also served as an administrative law judge.
Outstanding, and thank you so much. To the one that's known on these streets as Dr. 100, because she keeps it real, that's our very own Dr. Maya Green. Dr. Green?
Good evening. Good evening, Nikki and Congressman. Thank you for creating this platform. Good evening, community. Thank you so much for joining. We appreciate your questions, comments, the feedback, and just the fellowship that we have here. I know this started now, I want to say over 4 years ago, still going strong. I'm excited about this conversation because we're getting ready to talk about moving the needle forward for our community. Thank you.
Outstanding, outstanding. Well, to my colleague who tends to leave me and have fun in the sun. However, it's like the congressman said earlier, it's cold all over the country. How you doing, Doug?
I'm not doing too bad. Thank you, Nikki. I'm a retired physician. I worked in the western suburbs for about 30 years and then spent 2 years with the congressman in his office in Washington, D.C., and it really opened my eyes, made me interested in public health and public service. And I'm going to try and contribute if I can.
Outstanding. Well, to the man who makes this possible for us each and every Monday night, to the one who teaches us that true wealth is health, our very own congressman of the Illinois 7th Congressional District, Congressman Danny K. Davis. Congressman?
Well, last week I was fortunate to attend the funeral of former President Jimmy Carter. And of course, he had lived to be 100 years old. And of course, he was the oldest president the country has had. And he probably did more work after he had become president and was no longer president than he was able to accomplish during his tenure as president. But we have a memory book whenever a member die and we remember them, or president or some individual, and you get a chance to go and write something in the book. And so I ran across a photograph that we had taken in President Carter's office when he was president. At that time, I was a member of the executive group of the National Association of Community Health Centers, and we had gotten a meeting with the president, and we were all as excited as we could be. I had never met a president of the United States before. I had never been to the Oval Office. And I don't think any of my other colleagues had either, the other people who were in the group. And we were so excited because President Jimmy Carter had given us a meeting at the White House. And we were in there to talk about the issues. And both he and his wife, First Lady Rosalind Carter, were both very supportive of health rights. And they were supportive of establishing community mental health centers. That's what Rosalind really was into. And she would come to many of the meetings and be there. He and Jody Powell and the people he had put in charge of some policy things, they were supportive. And we were just excited. I can't tell you. And he even had a cheat sheet in the way they had us lined up. He had information about each one of us and information about where we were from. And as you would walk in and he'd shake your hand and he had memorized whatever, and he says, "Well, Danny, how is Presbyterian St. Luke's Hospital doing in Chicago?" And so and so and so and so. And he did the same thing for everybody else. I remember a fellow named Louis Garcia at that time, who was a Mexican American, was the chairman, and I was the chairman elect, and so forth. And we just left there on air. I mean, in terms of having been to the White House, talked to the president, and I can't help but remember that back in those days when they started these things, there were 10 of them in the United States of America. 3 of the 10 were in Chicago, and Chicago had 3 of the first 10. The first one was started in Mississippi, the Tufts Delta project between Tufts Medical Center and the town and county in Mississippi, Mound Bayou. That was the Tufts Delta project. But there were 10 in the country. Now there are 1,400 of these spread throughout the nation. And I consider that to be one of the real evolutions and development. And of course, they got the idea from South Africa. That's kind of where the idea came from, and brought it back to the United States. Now they are taking care of all these people, more than 30 million. But people struggled all along the way. And so I guess my point and my question, as we move towards the celebration of the life of Dr. Martin Luther King and the movement, often when I talk to medical students and other health personnel and link Dr. King to this business of public health promotion, I think Dr. King did make a comment one time in terms of saying, of all the needs that existed in our society and the disparities that existed, nothing was greater or more pronounced than health in the health arena. So I would throw out a question. If we take away any of the resources that have been provided, and when I hear people talk about reducing Medicare or reducing Medicaid or cutting Social Security, I almost panic. I mean, I go to the panic button because if that happens, what happens to the health of especially low and moderate income people that have no other way of getting the service than resources be available? But can they even get the education that they need in order to know what to do? So I'd kind of toss that out as a question and as what we are facing right now. I mean, we are facing that predicament in our country as we talk about reducing resources, because when we reduce resources, we will reduce care.
I'm ready to jump in.
Go right ahead, Joe.
Yeah, the first thing I want to do is I want to start with a quote by Dr. Martin Luther King Jr. This is a quote that he made at a press conference. He was a speaker, I think it was at the American Hospital Association or the American Medical Association. And he said this in Chicago in 1966. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And so, what the congressman was talking about specifically was that gap, that inequity in healthcare. And one of the things that I've come to realize is while insurance is important, insurance is not healthcare. It's in the healthcare industry, but it's not healthcare. Doctors provide healthcare. Hospital provides healthcare. Insurance pays for healthcare. So there's a difference. They are a payer. They pay for healthcare, and they pay for a lot of healthcare for a lot of people. There's private insurance and there's public insurance. Two big public insurance are Medicare and Medicaid, and we have a lot of people receiving both Medicare and Medicaid. And so a lot, and most of the people in this country, and I don't think anyone pays for all of their health care. The government is there to provide support and assistance, and there's the insurance companies to provide support and assistance for people to have access to health care. Any change that sort of disrupts that system where there's no longer an availability for people to get the care they need will throw the system into chaos. I serve on the board of Community Health. It's one of the largest free clinics in the country. Been on the board for a number of years. Um, I was on the board at the time that the Affordable Care Act, what some people call Obamacare, was passed. Before the Affordable Care Act, most of the patients we saw, the vast majority of patients we saw, were African American. About 2 years, no more than 3 years after the passage of the Affordable Care Act, the number of African Americans coming to our clinic went down. Today, the largest percentage of patients we see are either Hispanic or Polish. That's the power of providing people that didn't have health care with some resource to access health care. And I'll stop there because my colleagues might want to chime in.
So I just want to echo what Joseph said about it being inhumane. But I think that we're in a dialogue with people who don't recognize that value. And I might stress that on terms of the dialogue they will understand. What we learned from COVID is without a healthy population, you will not have a healthy economy. So that's their number one interest. Number two, without a healthy nation, you can't have a healthy armed forces. Without a healthy nation, you won't have a healthy population of healthcare providers, which then jeopardizes national defense. But I think the most critical number that I've heard of recently is that healthcare inequities cost this country $454 billion a year. Now, here they are trying to trim the budget, trying to trim the deficit, and all that's going to do is make that number grow. I think that would be the first bit of data that I would share with them, that is, if they want to reduce the spending, they have to make the investment in healthcare. There's no other alternative. And address the inhumanity. Because that leads to things like healthcare executives being gunned down in New York City.
You know,
Go ahead, Congressman. And then Dr. Green, right after the Congressman.
there have been efforts to reduce healthcare costs. I mean, many conferences, many conversations, much research. And I remember going to a conference where the Fortune 500 executives were and had put it on. This was several years ago. And it was a very terse discussion. And then Senator Ted Kennedy was one of the speakers. And people applauded almost everything that the senator said, but they weren't going to do anything. I'm saying it was a rip-roaring Ted Kennedy speech, and from the applause and all of that, one would have thought that many of these ideas and thoughts were going to be implemented or supported, or efforts to do so. But it never happened. I mean, how do we reconcile the differences between what people say and what they do? I mean, that kind of led to my thoughts about that. That we often say one set of things, but we do another. And until we're actually saying it and doing it, there won't be much change.
No,
So-
Mark was going next, but Mark, you go after you.
Okay. All right. I guess a couple of thoughts on that, right? If there's no resources, then that's going to create financial barriers for already overlooked and underserved communities, right? Which is going to decrease kind of access to health points or their ability to access health points, which is going to decrease our ability to provide preventive care for people, which is going to, at the end, put a greater burden on emergency health services. So we can support on the front or we can support on the back. The only problem with supporting on the back when that person gets to emergency health is those that aren't sick enough to make it to emergency health are going to be at increased, vulnerability if something happens like what we just went through, a pandemic. If we recall the pandemic, those people living with untreated diabetes, asthma, heart disease, those kind of things unchecked, right? Were the ones that were having the worst outcomes, even unto death, right? Which definitely goes against. We hold these truths. I'll quote, make another quote, Mr. Harrington. We hold these truths to be self-evident that all men are created equal and endowed with unalienable rights, that being life, liberty, and the pursuit of happiness, right? Right? That whole group, 1776. And it goes against that.
Well,
Okay, Dr. Mason.
Yeah, first of all, let me say this very controversial statement. We do not have a healthcare system in America, period. We have a medical care system in America, but we do not have a healthcare system in America. We do not bundle all of the things together that help promote health. Housing is health. All kinds of other services that the congressman has fought for many times, those are all health things. But as a physician, I was never taught about health. I was taught to be a manager of diseases. I was not taught any nutrition. I wasn't taught about anything that could help people keep themselves healthy by the things that they eat. In the 4 years of medical school at the University of Illinois, I had 40 minutes of nutrition, and that was only about deficiency diseases. That was only talking about scurvy, beriberi, these very, very extreme situations for the most part that we're seeing oftentimes more in lesser developed countries. You know, there are a lot of things that have helped ourselves along, trying to do a better job. Many of those things have been like the creation of federally qualified health centers where people could at least go in and get medical care at a reasonable cost and a reasonable frequency and things of that nature. But when we look at food and we look at the other things that really are the causes, I mean, I'm doing lectures now and I'm talking, people are telling me about heart disease. I said, we don't have heart disease. We have a foodborne illness that creates damage to our arteries. That's what we have. And that foodborne illness is those things that we are eating and are really being encouraged to eat from our advertising and things of that nature. So to me, if we're going to really have a conversation about real health, let's have it by what those things are that control health. And Congressman, you've been involved in a number of those conversations about the role that economics, the role that, what happens in these communities, what kind of communities they have, what kind of food things are available to them. But more importantly, the foods that are available to them. What are the foods that people are going to eat? Because it's one thing to put, and we saw this in the things that we did, particularly in the southern suburbs and some other places, where people have not had, like you did, Congressman, and maybe like I did, where beans and greens were constant and frequent flyers on our dinner table. A lot of people haven't gotten it. So when we did put up the right stores where people could get that food, the stores closed because the people didn't buy the food, because they didn't eat the food. So there's a number of layers if we're going to be serious about this and not just have conversations that go nowhere. We got to get really serious about those things where we can deal with these at the level of causation. And that to me is food and availability, decent housing, safe neighborhoods, things of that nature.
Can I ask about food deserts then? That when people talk about food deserts, what are they talking about? What are they really saying?
Mari Gallagher some time ago did a study looking at the relative distances of grocery stores and other things to where people live. And she came up with an interesting algorithm that talked about in some of these communities, and she tried to link it to the increases in cardiovascular disease and what have you. But what she tried to do was say that if these things were had certain distances from them, it made it much more difficult for people to access them. And that was true. But I'm going to add one other thing. One thing that I talked to Wayne Giles about doing a study, another study similar to what Mari Gallagher did, but for a different reason. And that is appetite deserts. Because what you find is that when you put some of these stores right back in these communities, just like the Whole Foods that fell for a number of reasons, but if you put these things in the neighborhood where people could get the good food, but they're not used to eating it. In other words, they're in an appetite desert where people have not been trained and eaten these foods over time. Then the people, like we saw happen in some of the grocery stores on the south side, they ended up throwing away most of those greens and beans and stuff like that. So I'll stop right there because there's more I could say.
Yeah, I just want to chime in and pick up for what Dr. Mason said, because we actually attended the press conference where Mari Gallagher released her report, got a chance to talk to her, meet her, and become friends with her moving forward. And it was interesting because what she did, that term captured the nation. And what you saw is communities all across the country began to realize that they had food deserts. They had areas that had limited access to healthy foods in a lot of the grocery stores. So it's not just a local problem, it's a national problem. And Dr. Mason also talks about what people consider food. And I would offer this because I did want to look and get some data. So I went on the internet. Uh, and this I've known and I've read about for maybe about the last 6 or 7 years. And they talk about this phenomenon called food eaten away from home. And what that is food purchased from a commercial food service establishment or other eating facilities, like McDonald's, like Dunkin' Donuts, like Burger King. And in 2023, food eaten away from home accounted for 58% of all food spending in the United States, the highest share ever recorded. So how could you expect people to be healthy if most of the people in the country don't know where their food came from? They don't know how it was processed or how it was prepared. They don't know what the ingredients are. And in concomitant with that, we have this obesity epidemic. That's because people are not eating a healthy diet. And so I'll stop there because there may be other people. I don't want to get on a rant.
No, I think this is simply fantastic. Just want to pull in some of our community for a second. Want to say hey to our care team over at the Core Center who said that we've been missing them. So, hey, Core Center, how are you? Want to say hey to Sister Bonnie. She's here. She says, good evening. Tyrena Newkirk Sutton says, good evening, community health leaders. Audrey J. Cox is here and she says, good evening and happy new year to everyone. Alderman Pat Dow is here and she says, this is a hot topic. Valdemar Talley is here. Hey, Chief Talley. He says, good evening to everyone. He says, do you think, let me make this a little larger to ensure that I can see it. He says, do you think it's time for a robust insurance industry change, pay for healthy patients versus response to illness? All right, that's what he said. And Ms. Newkirk says, with regard to equality and access to healthcare, I am very worried about our seniors. Many of them are unsure on how to transition to Medicare and how to access those resources. How can we help them? They're asking how can we help them? If I go over to Instagram, I have just a couple notions over here, and I have someone who says, thank you, Dr. Mason, for actually sharing in reference to food deserts. We do have food deserts, but we don't have a fried chicken desert. You can find a chicken shack anywhere, and they're selling unhealthy grade B or C chicken when we can go to a grocery store and buy grade A chicken wings and fry them healthier at our homes. I'm wondering, do we need to have cooking classes, or is this an education issue since they took home economics out of the schools and no one knows how to cook anymore?
or is it a money issue? Is it a poverty issue? I mean, I live in, I guess, what one would call a semi inner city area. And there are grocery stores around, but there are people who don't have the money, the resources to purchase some of these things that we would call quality food. I mean, they just don't have the money. And so you can't get blood out of a turnip. I mean, you can do all kind of other things, but you end up with turnip juice no matter how you cut it and what you do. So are we talking as much about poverty and a lack of resources as well as talking about not having the understanding, education, awareness, and all of the other things that go along? But that poverty is as much of a factor as any of these other things. I mean, when I look at the median family income, say in my congressional district, and it's elevated because they are the highs and the lows. And of course, the highs kind of pull up what becomes the median. But there are an awful lot of poor people, low income people who just don't have enough money, quite frankly, to acquire these quality products that we talk about eating.
I would I would say, Congressman, that what has happened is that, well, let me go back a minute. We don't get taught any nutrition. We don't get taught any health in medical school. We are nothing more than the arbiters for the disease, for the pharmaceutical industry and the device manufacturers. That's who we are. Our job is to recognize certain diseases that can be modified by certain um, interventions, some of those medical, some of those surgical. You got to remember that we weren't talking about nutrition at all. The only way we got started with talking about nutrition is because when early on we were in training, and people used to get pancreatic cancer, and we would go and take out their pancreas and part of the duodenum and all that sort of stuff, and wonder why the people weren't healing, was because they had not enough nutrition to help the body begin to try and heal itself. That was the beginning of what was called hyperalimentation, where we began to come up with substances that we started to give to people intravenously, because they were unable to even eat the foods that would be necessary for them. I can also tell you that until we change or begin to improve education in medical school to include not just what medications persons need, but to include what what our people should be eating, and in a real sort of way. And we can't talk about that right now, but there's no incentive for healthy people. You cannot extract income off of healthy people. You must have people that are sick, that will use all these modalities that we have. And I'm not saying they're bad. I'm just telling you the truth of this is what it is. And until we change our focus, that's what it's going to be.
Yeah, go ahead, Mike.
So the congressman earlier you mentioned poverty and lack of resources. I agree. There is poverty in this country. I definitely think in this country there may not necessarily be a lack of resources. They're not. They're just distributed, differently, inequitably, things like that. And so when we talk about then moving forward and removing more resources from the most oppressed and overlooked, underserved, I too get super nervous. I too get super concerned because it goes back. I thought we were all created equal, and then the actions need to show that, and demonstrate that. So I think also bringing together some of the things that people have said about where there's a book called Political Determinants of Health by Daniel Dawes that kind of talks about this in the background, the structure, but where the restaurants are that sell low grade foods, where the restaurants are that sell high grade foods. Then I submit that, maybe somebody should look at how close the dialysis centers are to restaurants that serve those low grade foods, and which cultures, which people own both. Right. And then is that a cycle that is that puts people in the cycle that contributes to the cycle of poverty, the cycle of oppression? I remember one time when we were on, and I think Dr. Ansel was on, and we were talking, and I said, well, Dr. Ansel, poverty is a strategic form of oppression. And until we really, really kind of, I think, just, address that, then, we're going to end up here where we're even considering removing resources from the most overlooked and underserved people. We're going to keep doing that. Thank you to the congressman and so many other people that are bringing these things to light and opening up discussions. So that we can make the changes and have the impact that we need to have to secure a United States where all men are treated equal, like we are created.
Well, I guess, is there any hope for capitalism as a way of living? Or, I see Reverend Fields just came in. Is the Bible just correct where they talk about you will always have the poor with you? I'm saying, can we make capitalism in terms of the principles and practices of capitalism? And here we are now with a group of billionaires who want to run the country. I mean, billionaires.
Yes, sir.
Wanting to run the country. And I understand that several cabinet heads who've been nominated and will in all likelihood get confirmed. What are we really up against? Is it serious, or is it a nightmare? Is it out of order? Is it off the case? Or is there an answer?
So I want to address that one. It's all from Milton Friedman, who said many years ago that the responsibility of the board of directors is to increase shareholder value. And I think that we need to help those people who believe that that's the only truth, let them know that it has to evolve further. Because under that set of circumstances, we've had air pollution, water pollution, unsafe vehicles, unsafe planes, unsafe cars, not to mention weapons of, war weapons that are on the streets. I think we have to amend that to say that the responsibility of the board is to improve the quality of the life of the shareholder, because if you don't and you kill them all off, there's no one to buy shares in the company. So to going back to your answers, I think we have to have stakeholder alignment. You can't just say, we're going to make as much profit as we can and poison the air, poison the water, and poison our communities. That doesn't work. There won't be any more shareholders left. So we have to amend that. We have to have a newer definition of capitalism, and one that has the understanding that you have to look after the shareholders and the employees as well. Otherwise, you'll no longer have any product to manufacture, any product to sell, and anybody to buy your product, and no profits.
If I could
Okay.
just add,
Go ahead,
sorry.
Pastor Fields.
Yeah, if I, to your question, Congressman, yes, the Bible does say that the poor we have with us always, and the Bible also says it's the love of money that's the root of all evil. And oftentimes, one of the big things with capitalism that you have, profit without compassion, and that can come in various forms. And the fact that we have the poor always, the Bible in many different ways lifts up how to be compassionate to those who are poor, for those who have less resources. And so, though it at least the Bible says that will exist, it does not resolve us from being of help and being compassionate, because even as the Bible says, as we lend to the poor, we lend unto the Lord. And so that becomes a challenge for those, whether you're on the high end, the middle end, or low end, is that for those who are least among us, as the Bible talks about, we are to show compassion and to help. And unfortunately, as I was hearing something the other day, I think there are three men whose combined wealth is more than the wealth of half the people in the country. Some of y'all may have that stat better than I. And so when you have capitalism without compassion, then we have these things that we're seeing, whereby it's oppressive and people cannot have an adequate quality of life.
Joe?
Yeah. I'll jump in, and I've got a lot to say because I've tried, and I didn't want to interrupt anybody. I want people to say what they had to say. I'm going to start with what Maya said about all men are created equal. That is a powerful statement, but nobody said that all men would be treated equally. And so that's where we are. The reality is the statement is true, but that's not the way history has shown it to be in this country. The other thing, and I wanted to verify the quote, and Yul Brynner said it in the Magnificent Seven. And it's an interesting quote. If God didn't want them sheared, he would not have made them sheep. So some people think there are groups here that deserve to be in the situation that they're in, and that's what they were born to be, that they don't deserve anymore. And I'm not going to say what group, but there are people that believe that some people are lesser than them, and none of those people that are a part of this conversation this evening. So we do have some problems, but we are in a position to change some of this, because picking up on what Maya said, we are the people, they are not. And we are in a position, in a unique position, as citizens of this country, and people have the ability to vote, to put in and elect people that will represent and serve us in the way we'd want to. And this last election showed that maybe people think somebody is going to operate in their best interest, but you have to be careful who you vote for, because you have to live with whatever they do once they get elected. So it's a very complex problem. And so I think we could throw out easy answers, but there are no easy answers. But I would again say we are the people.
Outstanding. Well, Connie Taylor is here and she says, good evening, everyone. Belinda Sanders Martin is here. Hey, Sister Martin, how are you? She says, Jesus, help us. Now, I have a couple inbox messages that I have to read. I have I have a couple specifically for the congressman. And this one says, Congressman, thank you so much for talking about the poverty. because that's true. I am a healthcare professional, actually an executive healthcare professional. And just about 10 years ago, a hip replacement actually averaged between $12,000 to $18,000. And on today, Congressman, a hip replacement is averaging anywhere around $39,000 to $74,000. I had to have one. The 20% copay through my insurance and all of the additional bills I had to pay is going to put me in poverty. And I just have to share with you, you are absolutely right. It's about poverty. And are they going to put us in poverty? Well, Congressman, we have another one that's for you that says, hey, Congressman, you always keep us on our toes. I can never say that any Monday night is ever a dull moment. I am a pharmacist within the Illinois Medical District, the mecca of medicine. I currently have cancer, breast cancer. I've had to have a mastectomy twice, my left breast first, little over 10 years ago, and it only cost $10,600. I had to have my second breast removed just about a year ago, and it has doubled, $55,000. I'm sorry, not doubled, quadrupled. It's putting us all in the poorhouse. I am a professional who had to pay back student loans, who has a family, trying to make the difference and giving back. And these bills are astronomical. Between healthcare costs and big pharma, how do we live?
I think Joe had an answer earlier. Everybody in, nobody out in terms of one system. And let me just tell you, it's interesting because we've just recently had experiences with constituents who have had those exact problems that they've shared with us in the last 2 weeks. Exact problem. 39,000, 40,000. And even when you pay your part, you still, and these are people who, got decent work experiences and the whole thing. But I can tell you, if 10 or 12 billionaires determine the policies, they're going to be trying to make more billionaires because their policies are going to be such. And with technology, I just finished reading an article in USA Today about driverless cars are reaching the point where pretty soon they're going to be for real, in a real way. So I think there are challenges, and many of those challenges are indeed profound. Joe had the other answer, though, in terms of saying ultimately it is the people. But if the people are either lulled into a position of believing that they are more secure than what they actually are, as we are experiencing right now in California, in terms of the devastation of what is taking place there. It does require a lot of thought and a lot of action, and the realities of knowing that this business of struggle is much more than just somebody's quote or just something to think about. But all of these guys were profound and knew what they were talking about when they made these comments. Struggle, strife, and pain are the required requisites for change. And if there is no struggle,
Progress.
there is no progress.
Well, that takes us back to Belinda Sanders Martin and her Jesus Help Us. And also Kim Alexander Jackson. Hey, Kim. Kim says, Lord, help us. Kim also says, thank you for hosting this every week. Now, I also have an inbox from Stephanie that says, Pastor Sai, can you share those scriptures or where she can locate those scriptures that you referenced to in the chat? And once he remembers them, I know he'll send them to me and we will put those in the chat for you. I know that we will. So, Dr. Green, how do we survive? I mean, what do we do?
I think the pandemic gave us some clues. I think Mr. Harrington gave some clues. Going back to, I guess, what Dr. Mason always says, we have to use the tools we have, which is maybe right now, those of us that have the ability to grow and share within our community. Number one, to primary prevention, secondary prevention, tertiary prevention. We have to band together as a community to keep ourselves out of whatever systems are being created by staying as healthy as we can for as long as we can, right? And making some choices. Now, those choices, we got to get in community and offer each other choices like growing healthy stuff, staying off, and knowing kind of what's good for the body, what's not good for the body. The other thing I want to mention right now, now, whenever this comes up again, I always say this. It's not voting season. It's always voting season. You vote 365 days with your dollars and your intent. But other than that, every time we come to the opportunity to choose elected officials, right? People have to explain to you why certain elected officials are important to holding up our community, right? Very frustrated with ourselves sometimes because it's like almost like we forget. We forget who upholds our community. We forget who goes in those spaces and votes for us. And we talk about wanting to replace them with new people and things like that that don't know the business from anything. All right. Now, in this moment, everybody, I love the comments and everything like that. While we're typing that comments and while we're hearing this, let's talk to our families about why we have to keep officials who, because I will say, Congressman Davis didn't even have to bring this up and say, hey, y'all, think about this. This is, or our officials that go in there and make the votes and make the laws to help keep us safe, right? When the time comes to vote for people who vote for us, let's not have a lot of back and forth and then type Jesus help us in. And, I'm not saying the person to type that, but I know all of us are thinking that Jesus help us, well, maybe sometimes Jesus gives us the opportunity to help ourselves when it's time to vote. I'm going to say that.
Maya, you're absolutely right. And I always say it because it's true in my mind. Ain't no Calvary coming. Ain't nobody coming to save us or from whatever it is that we are having problems from. If this is a responsibility, that we've got to do. Prayer is helpful, but faith without works is dead. We got to
come on now, Bishop. Come on.
No, we got to stop talking and moaning and groaning and complaining and all that kind of stuff. The issue is like Jim Brown said it to Richard Pryor in one of the movies. He said, "What you gonna do?" So the thing is, our question is, what are we going to do? We can talk about all this stuff till 5 o'clock in the morning, but if we don't spend 15 minutes talking about what are we going to do, it's a waste of time. And so there are things we can do. Congressman Davis has been in the political arena for a long time, along with others, and we can band together better. He can guide us as to what we could do at that level. And in our churches, I go back to John, the first book in the Bible. Do we really want to be well? And if so, what do we need to do to act like it? And there are things that we can do to act like it and begin to improve our health that don't cost a lot of money. And we can talk about that at another time. But there are other things you've got to understand, that the disease detection and management system exists for a purpose. The reason that we have more of these, somebody asked about dialysis centers. Well, you look at the dialysis center, and you look at the nexus of people who have diabetes and hypertension in those same communities. Look at the stores that they see and frequent. Look at the things that we're eating. And I'm not trying to blame the victim, because there's a whole lot more to it. And I think that we could have more time to talk about that at another time. But I'm just going to say this: ain't no cavalry coming. Ain't nobody going to help us but us, because that's just the way it is. Now, we may find people who will support what we're doing, but the people that profit from this illness are not going to sit by and be careful and do nothing while we try and do something.
Well, absolutely. Joe, were you trying to say something, or did I misread? You're muted, Joe. You're muted.
Yeah, I could always find something to say, but I think this has been a robust conversation. I'm going to wait till you ask me for my last words, and then I'll say. Because some of us have said the same things in different ways, but they've all been powerful.
Absolutely. Well, Kim Alexander Jackson says, "Preach, Dr. Maya." And Audrey J. Cox says, "For real, Dr. Mason." And with that being said, it's our time. So we're going to go straight into your until next Monday. So, Dr. Mason, what's your until next Monday?
Look at the things that you have. We got to look at the things that God gave us. He looks at, we got 2 hands. What are we doing with them? We got 2 feet, 2 ears. We got all this stuff. You have to do what you can where you are. And don't be worried that you can't do it for everybody right now. But start with yourself. We can eat better. We can drink better. We can do a number of things ourselves. The question we need to ask ourselves: do we really want to be well? Do we really want to be well? Because we don't act like it. We're not doing things that are consistent with being well. And I'm going to stop right there, because I'll get wound up again.
All right. Well, Pastor Phil sent those scriptures to the people who were asking where could they find them. And I've posted them here in the chat. It's Matthew 26:11, Deuteronomy 15:11, 1 Corinthians 4:7, and Proverbs 19:17. For those of you who were asking, what did Dr. Maya mean by you can vote every day? She meant voting every day with your money. Pay attention to the D2s and who donates money to certain places that you don't support. And those are places you should not shop at. So there are a number of stores that I do not shop at because they did not support my interests. They supported someone else's interests. So if we don't give them our money, then we are voting each and every day. Well, Joe, you're until next Monday.
Yeah, I thought about this, and I framed my statement early in the conversation, because I was reminded of one of my favorite poems, which I learned while I was pledging, and that's an Invictus. And I'm going to leave you with these words, and this is the last stanza in Invictus. I am the master of my fate. I am the captain of my soul. Each of us are the masters of our faith. We can make decisions. We can decide what we will do, what we won't do, what we will eat, what we won't eat. You have choices and you can make decisions. Regardless of your means, you can make decisions that improve your health. And I'd encourage you to do that.
Outstanding, Doug. You're until next Monday.
Well, I want to say that I agree with Dr. Mason and with Joseph, and also with the congressman about his concern for the future. When I thought about this is not going to have a short-term solution. It's going to have a long-term solution. It's going to require lots of effort. And I'd start by studying the Federal Society and Project 2025, which seems to be the blueprint of the game plan that they're playing. Every game plan has to have a counter game plan. It's going to be up to us to study, to think, to plan strategically for the end of the game.
Outstanding. Well, Pastor Fields, you're until next Monday.
Until next Monday, I want to lift up 3 John verse 2, where it says, above all things, I wish that you would prosper and be in good health, even as your soul prosper. God has a vested interest in you prospering both in your health and in your spirit. And as we talked about tonight about the poor and poverty, here's some things we can do. I agree with Dr. Mason. Faith without works is dead. This is what we can do. Advocate for better education. Speak up when the poor is mistreated. Defend the poor from abuse and other unfair practices. And let's not be greedy and give into materialism. We can do some things until we make this a better place. Thank you so much.
Outstanding. Well, Congressman, take us home.
Well, I'm going to just follow the minister and invoke a bit of prayer for Dr. James Miller. I know he's in good hands in the hospital and with the physicians, but I'm going to ask the other doctor to make sure he's in the room with him and that he comes out of this in better shape than he was in before he went in. In the last thought, from a historical perspective, I think that we are in a period very similar to where African Americans were in this country at the end of the Reconstruction period after slavery. And there were elements who thought too much progress had been made by these groups at that time. And there was reaction to take away the benefits of the Reconstruction period. I think there are efforts underway to take away the benefits and growth of the civil rights movement, of the period where people thought that race and race relations had reached levels beyond what they've reached. And then the realities of the 2024 elections suggested something different. And people organized the NAACPs and the Niagara movements and other groups and organizations to fight back. And I think that's where we are now. I really saw more African American observance of Kwanzaa this past year, than I've seen in several years past. And I think part of what drove it was the realization that race does matter. And race becomes part of a salad bowl as opposed to the melting pot. and that you can be part of the salad, but you can identify elements in the salad. You can see an olive, you can see a tomato, you can see a cucumber. It hasn't quite melted the way we think a melting pot might do. And so my last thought is never forget the elements of the salad bowl and know your identity as part of a great dish. So thank you all. It's been a great evening, and I just wait until next Monday. I'm excited about it. Have a good night and see you somewhere as we celebrate Dr. King's life, legacy, and birthday. Thank you.